Hi, my name is Megan Andersen, and my capstone presentation is over the infant formula shortage. The infant formula shortage happened in 2022 due to a dangerous contamination in a Abbott nutrition plant that was in Michigan. It affected millions of infants and children that need infant formula on a daily basis. A quote from Deb Fisher from 2022 stated, "Abbott is one of the 4 companies in the U.S. that produce 90% of our nation's baby formula, and its Michigan plant is estimated to supply roughly 20% of the nation's baby formula alone." The demographics and communities involved were primarily those who rely on WIC benefits because it limits the brands of formula that are available to them, and the main brand that they are able to purchase is from Abbott Nutrition. The shortage also increased the prices of formula and made it even more difficult for low-income families to afford formula and those that require Medicaid assistance. I chose this topic because I lightly researched it in a previous class, and it was very interesting, and I wanted to learn more about it. I have nannied for the past 7 years, and during this time, I was nannying for a family that had an infant that solely relied on formula. It was a really scary situation that we had to navigate, but we were able to respond to the needs and provide a different formula, but we know that wasn't the case for many children during this time. I now talk about my educated citizen synthesis. Effective communicator number 1. This was an experience I had during clinical on 9 North. I had a young patient during clinical that was intubated when I met her, and she later progressed in a positive direction and was extubated on my shift. But then she began feeling very anxious and started to decompensate. The need for reintubation was determined, and a bunch of providers poured into her room. I stayed holding her hand and provided reassurance to her throughout the whole situation. I talked her through what was happening during every step and tried to calm her down for the providers to be able to reintubate her. I knew I wasn't going to be able to have a role in the intubation specifically due to me being a nursing student, but I knew what I could provide was calmness and support for her. What I learned during this experience was the importance of therapeutic communication. Both verbal and nonverbal communication were involved in this situation because I was talking to her while also holding her hand and providing therapeutic touch. I also learned the importance of taking initiative when appropriate in this situation specifically. I didn't wait for the nurse or provider to give me a role or task. I just jumped in where I saw fit. This is related to my public issue because it expands on the importance of being present and allowing those struggling to open up. Specifically in the infant formula shortage, I can use these skills to talk to families and mothers that are struggling during this time. And it's really important that you give reassurance when appropriate. And you can even offer a hand or give them a hug when they're able to open up about their struggles to you. For effective communicator number 2, this was an experience I had in the NICU during preceptorship. We had a mother of a NICU baby that spoke Spanish. We found out through a report that she was primarily Spanish speaking. So my nurse kind of talked me through how she handles these situations. My nurse uses a mix of her own knowledge along with some use of an interpreter to relay correct education and information to the patient. I told my nurse that I had studied Spanish since kindergarten, so I was able to help communicate with the patient. I filled in the gaps when my nurse didn't know the words for something, and she helped me with the Spanish words for medical phrases that I didn't learn in school. Together, we were able to fully communicate with the patient, and she understood what we were saying, which was a great feeling. What I learned was that I need to have confidence in my Spanish-speaking abilities. Even though I'd never used Spanish outside of a classroom setting, I realized that I am able to talk with patients and make sure that they feel seen and heard. I've gained confidence through communicating with people from different backgrounds, and it's an amazing feeling to see the look on a patient's face when you speak their language. During this experience, the patient was able to ask us questions that she had been saving all day because the day shift nurse did not speak Spanish nor use the translator. I'm super grateful to be under the guidance of my preceptor who values effective communication with her patients. We also did use the translation services when lactation came to consult with the mother. And this was very useful because the lactation consultant didn't speak Spanish at all either. How does this relate to my public issue? I have a better understanding of those from different backgrounds, and I would use my skill of Spanish speaking to my advantage when working with families struggling from the formula shortage. Many families that struggled from the shortage came from a variety of racial and ethnic backgrounds. For the families that speak Spanish, I would connect them with the proper resources, and I learned about the importance of this through an article from Bauer in 2022. I would spend the time to have the communications and ensure that their unique needs are met and connect them with adequate resources that would be helpful to them. For my reflective individual number 1, this was a clinical experience I had in the CVOR. I had clinical on 9 North, and my instructor asked if any of us wanted to go to the OR to see surgery. I immediately jumped at the opportunity and was able to watch a cabbage and double valve replacement. I went down and met the patient and their family, and they said to me as they wheeled him back, "Take care of him." That sentence stuck with me throughout the entire surgery. As the surgery progressed, a few complications arose, and the team worked together to solve them with ease. I kept thinking back to what the family had said, and I felt connected to the patient and the family. What I learned in this experience was that as I was watching and staring at the patient's beating heart, I took a step back and reflect on how precious life is and how much trust is put into our hands as healthcare professionals. It's easy to turn on autopilot as a nurse, but it's important in times like this to step back and view the patient as a person with a loving family waiting for them. I reflected on the dedication that every single person of the healthcare team has to safely perform an intense surgery, such as a cabbage. This is related to my public issue because I learned how precious every single life is, and you never know what someone's going through. I also use this understanding to fuel change in the infant formula shortage, and I would help enact change with those community members that I meet and have connections with. I would also use this to use my experience with being a nanny to a child that was reliant on infant formula. I would speak to local officials about my experiences, and because this is the best way to enact change in our local government officials. For reflective individual number 2, I had an clinical experience with the mobile diabetes clinic. I began the day very anxious and nervous to make small talk with the individuals that came onto the MDC. I also felt that I was not prepared because of my lack of prior healthcare experience. As the day progressed, I learned how to relate to people that I encountered, conversate with them, and provide adequate healthcare screening to them. I quickly let go of my unconscious biases that I had prior to the day because I also saw how timid the people were that came onto the MDC. What I learned was how to relate to patients of different backgrounds. I also learned how to open myself up to individuals that I come across in the healthcare setting. I learned that many people are intimidated by healthcare professionals and that I must be an open and welcoming presence to provide the best care to my patients. I also learned through this experience how to relate to my patients and properly take care of them from a holistic point of view, and the importance of evaluating unconscious biases frequently to ensure that they're not hindering my care that I provide. This is related to my public issue because I would teach government officials about unconscious bias related to the infant formula shortage. I would teach them about how different communities were disproportionately affected due to the high rise of formula costs during the shortage. And I would help facilitate education on the formula shortage, which the article from Kiev et al. talked about the importance of education. I would also be non-judgmental and meet these clients where they are to adequately connect them with the resources they need. And I often reflect on encounters I have with patients, and this trait helps me to learn and grow in my abilities to treat future patients. In my change agent number 1 experience, I had a clinical experience at Community Alliance. I had never heard of the organization prior to orientation. I was initially nervous and unsure about the clinical site. I did not let my emotions or biases affect my readiness to learn. I met with a young gentleman sitting alone and decided to strike up a conversation, and he ended up telling and teaching me about his YouTube channel that was focused on history that he makes with his friends. He was very eager to teach me, and I was more than happy to learn. I'm not a huge history genius like he was, but he was super happy that I sat down with him and thanked him for letting me talk to him about his channel. What I learned from the experience was the importance of stepping out of your comfort zone. I was pleasantly surprised at the experience and did not find it difficult to strike up conversations with those that I encountered at Community Alliance. The experience taught me the importance of continuing to challenge myself and that you never know who you meet if you don't put yourself out there. This is related to my public issue because it taught me how to advocate for others and also to find the importance of finding the root cause of issues. I believe it's extremely important to put yourself in the shoes of those that are affected and understand what it's like to experience the fear of not having formula to feed your baby. This would motivate me to find answers to the problem and help families in need, no matter their background. For my change agent number 2, I had an experience in postpartum during preceptorship. I had a patient that was giving birth to her 5th baby and was of Egyptian descent. She spoke Sudanese Arabic primarily and had very limited English comprehension. We learned during a report that she had a very chaotic labor, and this was her first childbirth in America and in a hospital. When I heard a report, I had biases come up in my head that she would be against medicines, formulas, vaccines, and other medical interventions, but I was quickly proven wrong throughout the night. What I learned from this experience that everyone's beliefs are unique no matter their racial or ethnic backgrounds, and it's very important to learn from your patients and not let your biases cloud your judgment. The situation reaffirmed the importance of allowing patients to express their own needs, and it's not fair to categorize patients into different boxes. This is related to my public issue because it reinforces the importance of being judgment-free. I should not judge or have preconceived notions on who would have needed infant formula when the shortage was at its peak. I would help every family I encounter and understand that every family has their unique wants and needs. An article from Patek illustrated the importance of connecting everyone to valuable resources during this epidemic that we encountered. And my conclusion is that overall, the infant formula shortage was very heavily federally mandated, and that there is a high need for emergency preparedness in Omaha, and this shortage really made Omaha be proactive instead of reactive in future shortages and different things that could arise that we might not be prepared for. I learned through being an effective communicator the importance in advocacy. In being a reflective individual, I learned about recognizing and addressing unconscious biases when dealing with different populations in our community. And I learned in being a change agent that it's important to connect people to equitable resources. And these are my references. Thank you for listening.